Welcome! In this lesson, we'll walk through the Roux-en-Y gastric bypass surgery. The Roux-en-Y gastric bypass is a French term meaning in the form of a Y. The surgery is often just called gastric bypass, and it's one of the most common operations for weight loss. It will help you lose 70% or more of your excess weight. So let's break down the step in the procedures. First, the stomach is divided into a smaller top portion called the pouch, which is about the size of an egg. The larger part of the stomach is bypassed and will no longer store or digest food. Then the small intestine is divided and connected to the new stomach pouch to allow food to pass. The small bowel segment, which empties the bypass stomach, is connected to the small bowel approximately 3 to 4 feet downstream, resulting in a bowel connecting resembling the shape of the letter Y. At the Y connection, the stomach acids and digestive enzymes from the bypass stomach and the first portion of the small intestine will mix with food that is eaten. The gastric bypass works in several ways. First, the newly created stomach pouch is smaller and holds less food, which will help with portion control and fewer calories are ingested. Additionally, the food won't come into contact with the first portion of the small bowels, and this will result in decreased absorption. Most importantly, modifying the food course through the gastrointestinal tract has a profound effect on decreasing hunger, increasing fullness, and allowing the body to reach and maintain a healthy weight. Most patients who choose gastric bypass will see complete remission or improvement of their diabetes, high blood pressure, and sleep apnea. Patients also see a lessening of pain related to osteoarthritis and lessening of their heartburn, which is also called gastroesophageal reflux disease. Some patients even see an improvement in their fertility. Now, those who choose gastric bypass might experience dumping syndrome. You might not be familiar with that term, so let me explain it. Dumping syndrome is a condition where food, especially food that's high in sugar, moves from the stomach into the small bowel too quickly after you eat, which might cause abdominal cramps and diarrhea a few minutes or even few hours after eating. To prevent dumping syndrome, you should eat smaller meals and limit high sugar foods. There are other possible drawbacks of gastric bypass, such as leakage, which can occur where we connect the pouch to the small intestine or from connecting the small intestines to themselves. Other possible complications include pulmonary embolism, which is blood clots in the lungs, bleeding, infection, narrowing or ulceration of the hookup of the stomach to the intestine. Additionally, hernias can also happen and even death. Also, you're at slight risk of intestinal obstruction. Nutritional deficiencies also could occur, so you will have to take nutritional supplements for the rest of your life. While gastric bypass is reversible, the surgery to reverse it is even more difficult than gastric bypass itself, so it's only reversed in extreme situations. I know I've said this before, but as with any weight loss surgery, weight regain could happen if you don't watch your diet and follow an exercise regimen. Okay, you're doing great. I know this is a lot to take in, so when you're ready, I'll find you in our next lesson.